This is Plant-Based Briefing. New olive oil study sparks questions for whole food plant-based eaters by Elizabeth Turner at forksoverknives.com. And I'm your host, Marian Erickson, and this is the curated content plant-based podcast where I search the internet and find a variety of blogs and articles on plant-based, compassionate, and eco-friendly living, get permission, and read them to you here in about 10 minutes or less every weekday. And today, April 26th, is the 1-year anniversary since I launched the podcast. I can't believe a year has gone by. And when I started, I told myself I would do it for a year and see if I wanted to continue. And I absolutely do. I'm researching constantly. There's so much information coming out all the time. I find it fascinating, so I might as well continue sharing it, especially since the listenership is growing. And if you want to help it grow, please do give a shout out to the podcast on your social media, share it with others. Word of mouth is one of the best ways for podcasts to grow. And I chose a Forks Over Knives article for today's because it was Forks Over Knives that I read my very first episode. And regular listeners know this, but for any new listeners, forksoverknives.com is an amazing website, an amazing resource. It was founded by Brian Wendell following the release of the now world-famous documentary Forks Over Knives. You can watch it for free on YouTube, or you can find it linked at forksoverknives.com. But their mission is to show people how to regain control of their health and their lives with a plant-based diet. They have best-selling books, a mobile recipe app, tons of recipes on their website, the latest research, great success stories, and tools to help people at every phase of their plant-based journeys. And today's article is another great one from them because I remember back in January of this year, there were some posts about olive oil being good again. And there was a study released that it turns out that it lowers total and cause-specific mortality. Seemed a little surprising based on everything I've learned. And this article is great for clearing up any confusion. And it just goes to show that studies have to be looked at carefully and don't just quickly believe anything you read. So now let's get to today's plant-based briefing. New olive oil study sparks questions for whole food plant-based eaters by Elizabeth Turner at forksoverknives.com. A large new study out of Harvard suggests that a small daily dose of olive oil may substantially reduce the risk of early death. That's raising questions among whole food plant-based eaters, since avoiding added oil is a cornerstone of the whole food plant-based diet. The new study, published in January in the Journal of the American College of Cardiology, examined olive oil consumption and mortality using data collected from more than 90,000 healthcare workers over 28 years, 60,582 women in the Nurses' Health Study, and 31,801 men in the Health Professionals Follow-Up Study. Participants completed health assessment questionnaires every 2 years. Every 4 years, they answered detailed food frequency questionnaires that asked how often, on average, they had consumed specific foods in the preceding year, including types and brands of fats and oils used for cooking and added at the table. Over the 28 years follow-up period, 36,856 participants died. After adjusting for known risk factors and other dietary factors, researchers found that participants who consumed more than half a tablespoon a day of olive oil were 19% less likely to die of cardiovascular disease and all other causes. They were 29% less likely to die of neurodegenerative diseases such as Alzheimer's, 17% less likely to die of cancer, and 18% less likely to die of respiratory disease compared with those who never or rarely consumed olive oil. Our findings confirm current dietary recommendations to replace animal fats with plant oils for the prevention of chronic diseases and premature death, said the study's lead author, Marta Gauch-Faray, a senior research scientist in the Department of Nutrition at Harvard Chan School of Public Health. So, is oil healthy now? An important takeaway for whole food plant-based eaters is that the Harvard Health study analyzed death rates based on different types of added fat in the diet. They did not examine the benefits of a diet with little or no added oil. Nealbarnard, MD, FACC, addressed the question in the January 20th episode of the Exam Room by the Physicians Committee podcast. Olive oil is better than chicken fat, beef fat, cheese fat, dairy fat. It's better than all these, Barnard, president of the Physicians Committee for Responsible Medicine, told the Exam Room host Chuck Carroll. Chicken fat is 30% saturated fat. Beef is 50% saturated fat. But for olive oil, it's all the way down to 14%. That's good. Then Barnard offered a big caveat. But what if instead I get a nonstick pan and don't use any fat at all? That's best of all, because every gram of fat, no matter where it's from, has 9 calories, and our research has shown that when people get away from these fats in general, they do best of all. So olive oil, better than animal fats? Absolutely, slam dunk. But learning to really minimize even the oils, even the olive oil, is probably the best road, he said. The researchers have tried to make the case that there's something magical in olive oil, and there are various plant constituents, just as there are in broccoli and sweet potatoes. However, the big issue seems to be you're not eating the animal fat anymore, Barnard added. Indeed, while the new study found that replacing butter, mayonnaise, or dairy fat with olive oil was associated with a lower risk of total cause-specific mortality, they found no significant risk reduction when substituting olive oil for other vegetable oils. The study authors also noted that participants with higher olive oil intake tended to be more active than other participants and less likely to smoke. They also consumed more fruits and vegetables than those who ate less or no olive oil. The whole food plant-based case against oil. There's no question that when you get rid of all those other fats, olive oil, which is monounsaturated, is less harmful. However, the point is this: it's not to get an 18 or 19% risk reduction when what you're really striving for with cardiovascular disease is to eliminate it, said lifestyle medicine pioneer Caldwell-esselstyn, MD, author of Prevent and Reverse Heart Disease. When has Harvard ever done a study with oil where you take patients who are seriously ill with heart disease and you arrest and reverse it? That's what we were able to achieve, along with Dr. Dean Ornish and others who follow this kind of approach, Esselstyn said. In a 2014 study published in the Journal of Family Practice, Esselstyn and colleagues tested a whole food plant-based diet on 198 patient volunteers with established cardiovascular disease. Of the 177 patients, or 89%, who responded to intensive counseling and stuck with the diet for a mean of 3.7 years, only one patient had a major cardiovascular event, a stroke. Meanwhile, 13 of the 21 patients who didn't stick with the diet experienced adverse cardiac events. In 2019, Esselstyn wrote an editorial for the International Journal of Disease Reversal and Prevention, outlining a range of studies that show oil consumption promotes vascular injury, including research published in 2000 that examined the post-meal impact of olive oil on the endothelium, a membrane that lines the heart and blood vessels and helps control vascular relaxation and contraction. The study found that meals prepared with olive oil reduced flow-mediated dilation, a measure of arterial blood flow, by 31%. Another concern with added oil is its sheer calorie density and potential to promote overeating and weight gain. At 4,000 calories per pound, oil follows essentially the same model as processed sugar, which is also pressed from plants, explain Alona Polday, MD, and Matthew Lederman, MD, in the Forks Over Knives plan. Think about what oil is: fat and nothing but fat. Oil of any kind has more calories per gram than any other food we know. And without any fiber or water in it, oil lacks the bulk to convey to your senses how many calories you have eaten. This virtually guarantees you will consume more calories at the meal than you need. You just listened to New Olive Oil Study Sparks Questions for Whole Food Plant-Based Eaters by Elizabeth Turner at forksoverknives.com. And I'm Marian Erickson, your host, and if you're interested in other episodes about oil, I'll link to them in the show notes, but you can check out episode 31, 46, 78, and 150. And thanks for being here on my 1-year anniversary of the podcast. If you'd like to support it and support me, please share it with others, and give a shout out on social media to spread the word. And please also make sure you subscribe or follow wherever you do listen. And thank you so much for listening.